Picture your last physical. The nurse drew blood. A few days later, the results landed in your patient portal. And there it was, right in the middle of a long list of numbers. Fasting glucose, 94. Comfortably inside the normal range, which typically runs up to 99. Your doctor didn't mention it. Why would they? It's normal. You went home, you didn't think about it again, and by every measure available to you, your blood sugar is fine. Here's what I need you to sit with for a moment. That number, sitting comfortably inside a normal range, can stay exactly like that for years, sometimes for a full decade, while the actual disease process behind type 2 diabetes is already well underway underneath it. Your fasting glucose can look perfect for 10 years, while the damage is already running. Not because your doctor missed anything, not because the lab made an error, because of the specific way this particular disease is built to hide. Almost everyone who eventually gets a type 2 diabetes diagnosis tells the same story afterward. It felt sudden. 1 year, the labs were fine, and a year or two later, seemingly out of nowhere, they weren't. I understand exactly why it feels that way, because the paperwork genuinely does look sudden, but the disease itself is almost never sudden. What changes suddenly is only the moment a test finally catches up to it. Most of what I cover on this channel is a sign your body is already showing you, something to notice today. This one is different, because for years, there's essentially nothing to notice. So instead of walking you through symptoms, I want to walk you through time, 10 years of it, the way this actually unfolds inside a body, quietly, 1 year at a time, long before any diagnosis is ever written down. If you want health explained in plain language, without drama and without a sales pitch, subscribe and tap the like button. The goal for Dr. Shigeaki Hinohara is 20,000 subscribers, and every person who joins moves that number closer. To understand the timeline, you first need to understand one relationship, the one between a hormone called insulin and the sugar circulating in your blood. Think of glucose, the sugar in your bloodstream, as cars arriving after every meal, needing somewhere to park. Your cells, particularly in your muscles and liver, are the parking garages, and insulin is the traffic officer standing at the entrance, signaling the gates to open and letting the cars in. In a body where this system runs cleanly, the officer gives one signal. The gates open smoothly, the cars park, and your blood sugar drops back down within an hour or two. Insulin resistance is what happens when those gates start responding sluggishly to the officer's signal. It doesn't happen overnight, and it isn't usually caused by one single thing. It builds slowly out of a combination of expanding fat around your organs, chronic low-grade inflammation, a sedentary daily rhythm, and a diet that keeps demanding large, frequent insulin signals in the first place. As the gates grow less responsive, the same signal moves fewer cars, and your pancreas, sensing that glucose is lingering too long in the bloodstream, does the only thing it knows how to do. It sends a second officer, then a third. It raises its voice again and again, producing more and more insulin to force the same gates open. For a long time, this actually works. And that, more than anything else, is why this entire process is invisible on the tests your doctor runs every year. Let me walk you through exactly how it unfolds. Year 1. Somewhere in a decade that will eventually end in a diagnosis. This is where it actually begins. And it begins with absolutely nothing to see. At the cellular level, in your muscle and liver tissue, the gates are just starting to grow, a little less responsive to insulin's signal. There's no test in a standard physical that would catch this. Your fasting glucose is completely normal because your pancreas hasn't even needed to raise its voice yet. If you were unusually thorough and asked for one of the few tests that could theoretically catch something this early, a fasting insulin level combined with a calculation called HOMA-IR, a formula researchers use to estimate insulin resistance directly rather than inferring it from glucose alone. It might show the faintest hint of extra effort, but almost no one orders that test in year one. Because in year one, nobody has any reason to. By year 3, your pancreas has noticed. Glucose is lingering a little longer after meals than it used to, and your beta cells, the insulin-producing cells tucked into your pancreas, respond exactly the way they're built to respond. They produce more insulin. This is called compensatory hyperinsulinemia, and it's remarkably effective. Your fasting glucose test, if you took one this year, would still come back completely normal, sometimes even textbook perfect, because the extra insulin is successfully forcing those sluggish gates open. The problem hasn't gone away. It's being paid for, quietly, by a pancreas working harder than it used to. And a harder working pancreas doesn't show up as a number on a routine lab report. By year 5, the strain has started to spread beyond the pancreas itself. The extra insulin circulating in your blood, month after month, is a growth signal as much as a sugar-clearing signal, and chronically high levels of it encourage your body to keep storing fat rather than releasing it, particularly around your midsection. So the waistline creeps outward, a little at a time, in a way that gets chalked up to turning 40, or turning 50, or just getting older. It's rarely framed as a blood sugar problem, because nobody has measured a blood sugar problem yet. But the growing waist and the rising insulin are the same story, told in 2 different places on the body. Year 6 is where the 2 organs at the center of this story start working against each other instead of separately. Researchers at Newcastle University, studying how type 2 diabetes actually develops, described what's become known as the twin cycle hypothesis. As insulin resistance persists, excess fat doesn't just sit under your skin. Some of it spills over into places it was never meant to accumulate in large amounts, specifically your liver and your pancreas. Fat inside the liver makes the liver itself more insulin resistant, so it releases more glucose into your blood than it should. Fat inside the pancreas begins to interfere with the very beta cells producing all that extra insulin. 2 organs, each making the other's job harder, in a loop that reinforces itself. If you had a more detailed test this year, specifically a glucose tolerance test, where you drink a sugary solution and your blood is checked 2 hours later, rather than just once, while fasting, you might actually catch a spike that a fasting number alone would completely miss. Doctors call this isolated post-challenge hyperglycemia, blood sugar that looks fine fasting, but rises too high after a real meal. It's a real, recognized category. It's also almost never tested for, because the routine annual panel checks fasting glucose and stops there. By year 8, the years of overtime start to show. Beta cells that have spent the better part of a decade producing extra insulin, night after night, meal after meal, begin to fatigue. Their capacity to keep raising output starts to plateau, and in some people, begins to genuinely decline. This is the year fasting glucose typically starts to drift upward for the first time, often into a range like 95 to 99. Technically, by most laboratory reference ranges, that is still labeled normal. Practically, it's the first faint signature on paper of everything that's been happening underneath for years. Most doctors, glancing at a single number inside the normal range on a busy day, have no reason to flag it, and most patients, seeing the word normal next to their result, have no reason to ask. And then, year 10. This is usually the year the story finally becomes visible on paper. Fasting glucose crosses from high normal into the range of 100 to 125, or a related measurement called hemoglobin A1C, which reflects your average blood sugar over about 3 months, crosses into 5.7 to 6.4%. For the first time in this entire decade-long story, a standard test finally says something. The label attached to it is Prediabetes, and I want you to hear how strange that label actually is. Once you understand the timeline, it sounds like the beginning of a problem. It's closer to the final chapter of one. There's real research behind this exact pattern. A landmark study out of University College London, part of a long-running project called the Whitehall 2 study, followed thousands of people for years, tracking their blood sugar, their insulin sensitivity, and how hard their pancreas was working, long before any of them received a diabetes diagnosis. What the researchers found was that insulin sensitivity had already been quietly declining for roughly 5 years before diagnosis, and the compensatory insulin response, the pancreas raising its voice, had been climbing for even longer before it finally began to fail. The glucose numbers themselves, the ones that actually appear on a standard lab report, were often the very last thing to move. By the time they moved enough to get anyone's attention, the underlying process had already been running for the better part of a decade. I want to pause on something here, because it's the same pattern I keep running into on this channel. Across completely different organs, the tests that would actually catch years 1 through 8, the fasting insulin, the HOMA-IR calculation, the 2-hour glucose tolerance test, all exist. None of them are exotic or experimental. They're just not part of a standard annual panel, and a 7-minute appointment rarely has room to ask why a technically normal number might not be the whole story. A fasting glucose test is cheap and fast, and for most of this decade, it's also the wrong tool for the job. That isn't a conspiracy. It's simply what happens when a health system is built to react to numbers that have already crossed a line, rather than to notice the years of effort it took to get there. And if this timeline is allowed to continue past year 10 without anything changing, it doesn't stop at prediabetes. It continues toward a full type 2 diabetes diagnosis, sometimes a few years later, sometimes longer. Here's the detail from that eventual diagnosis day that I think everyone deserves to know, and almost no one is told. Research following newly diagnosed patients, including the large UK prospective diabetes study, has found that by the time type 2 diabetes is actually diagnosed, patients have often already lost roughly half of their functioning beta cell capacity. Half. Not gradually failing from that day forward. Already gone, quietly, over the years that led up to it. Now, I want to turn this around, because a decade-long silent process sounds like something you can't do anything about, and that isn't true. Here's the finding that changed how a lot of doctors, myself included, think about this entire timeline. A major clinical trial called DIRECT, led by the same Newcastle researchers behind the twin cycle hypothesis, put people with type 2 diabetes through a structured, medically supervised weight management program aimed specifically at reducing that excess fat in the liver and pancreas. The results, published in The Lancet, were striking. Nearly half of the participants in the program achieved full remission of their diabetes within a year, no longer meeting the criteria for the disease at all. And those who lost the most weight had the highest odds of remission. I want to be honest about what that trial actually involved, because it wasn't casual. It was a structured, medically supervised program with real clinical support behind it. Not a simple suggestion to eat a little less, but the underlying finding still stands, and it matters enormously. What that tells us is that a meaningful stretch of this timeline, likely years 6 through 8, and for many people even further, isn't a one-way street. Beta cells that are fatigued and underperforming are not automatically beta cells that are destroyed. Give them real, sustained relief from the fat and the overtime, and a genuine number of them come back. So here is what I actually want you to do with this. Stop treating a normal fasting glucose as the end of the conversation with your doctor, particularly if you're over 45, carry extra weight around your midsection, or have a parent or sibling with type 2 diabetes. Ask specifically about a hemoglobin A1C test, which captures a 3-month average and tends to catch trouble earlier than a single fasting number. If you want to go further, ask whether a fasting insulin level and a HOMA-IR calculation make sense for you. It's not part of a routine panel, and not every doctor will have it readily available, but it is the test built specifically to catch the part of this timeline that happens years before glucose itself ever moves. There's also a simpler, free check you can do today, right now, while you're thinking about it. Wrap a tape measure around your bare waist at the level of your belly button. For men, a measurement over 40 inches, and for women, over 35 inches, is associated with exactly the kind of visceral and organ fat that drives this entire timeline. It isn't a diagnosis, and plenty of exceptions exist, but it's a genuinely useful early flag that costs nothing and takes 10 seconds in a story where almost nothing else is visible for the better part of a decade. And broadly, the same habits that reduce the fat accumulating in your liver and pancreas, regular movement, a diet built around whole foods rather than a constant stream of refined carbohydrates, and that, where relevant, working with your doctor on a sensible path toward a healthier weight are the exact things that interrupt this timeline rather than simply slowing it down. I also want to say something about why this particular decade so often lands in the same years of a person's life. By government estimates, roughly 1 in 3 American adults already has prediabetes by the numbers we just walked through, and something like 8 in 10 of them have no idea. That share climbs steadily with age, which is precisely why this is a conversation I have more often with people in their 50s and 60s than with people in their 30s. It isn't that this only happens later in life. It's that a decade or more of quiet accumulation has usually had enough time to finish its work by then. Now, the honest part, because this story isn't identical for everyone, and I don't want you walking away thinking it is, this timeline is a composite built from population-level research, not a prediction of your personal decade. Some people move through it faster. Some people, particularly with a strong family history, carry meaningfully more genetic risk than lifestyle alone can explain, and can develop insulin resistance even at a healthy weight, doing everything reasonably right. Certain medications, including some steroids and other common prescriptions, can independently push blood sugar in this same direction, which is worth mentioning to your doctor if you're on one long term. This isn't a story about blame, and it was never meant to be one. It's a story about visibility, about understanding that the tests most of us rely on were never built to see the first 8 years of this, only the last 2. And if you take one thing from this video, let it be that a normal fasting glucose deserves a second question, not a closed door. Everything I've shared today is meant to help you understand a process, not to diagnose one. It is not a substitute for real blood work and a real conversation with your doctor about your personal risk, your family history, and which tests make sense for you specifically. Use this as the reason to ask a more specific question at your next appointment, not as a verdict on where you stand. If this changed how you'll look at your next set of labs, subscribe and hit the like button. That's how Dr. Shigeaki Hinohara gets closer to 200,000 subscribers, and how this reaches someone else, about to glance at a normal result and move on without a second thought. Share it with someone in your life who's been told for years that their numbers are fine, especially if diabetes runs in their family. Normal is not the same as nothing happening. Now you know the difference.